Okay, it looks like we've kind of slowed down with people joining the webinar. So we're going to go ahead and begin. Welcome. My name is Kendra Wide. I am a registered nurse. I'm also an air quality advocate in Michigan, and I am also a board member for Michigan Clinicians for Climate Action. And for those of you that aren't familiar with MiCCA, which we commonly call ourselves, we are a coalition of health professionals working at the intersection of climate and health. MiCCA is a state affiliate of the Medical Society Consortium on Climate and Health that works alongside over 100 medical societies and allied health groups in pursuit of a healthy, safe, and just world. I am also part of an informal group of public health advocates who meet monthly and share public health policy and actions as it relates to air quality in the state. We were formally organized as My Air, My Health over the past 10 years. It's disbanded, but many of us still meet informally. And it came to our attention that funding for Michigan's Department of Health and Human Resources asthma surveillance program was under threat by cuts to the CDC. And so we wanted to invite you all here today to make you aware of how these federal cuts are going to be impacting state programs. And given the recent air quality impacts that we've had from Canadian wildfires, and in combination with these cuts to the federally funded programs, we're going to have some threats to public health and environmental health from both cuts to funding to the CDC and EPA. We wanted to provide for you an overview of the current state of air quality in Michigan and how deeply these cuts will impact public health. And we want to end today's webinar with some actions that we can take. So I'm going to do a brief overview of the panelists that we will be meeting today. First off, we have Kezia Ofosu-Atta. She is the Director of Advocacy for Ohio and Michigan for the American Lung Association. She will be providing for us an overview of the state of the air and an update on air quality for Michigan. We also have with us today Dr. Alex Rabin. He is a practicing pulmonary and critical care specialist at the VA hospital, and he is also a clinical associate professor at the University of Michigan Medical School. He will be providing the clinician's perspective. We have Elizabeth Hupman with us. She is an advocate and mom. She is the Moms Clean Air Force Field Organizer for Michigan. She will be talking about her firsthand experience with advocacy for air quality at the federal level, and then also her experiences as a mom of a child with asthma. We also have Darren Riley with us. He is a co-founder and chief executive officer for JustAir Solutions. He's going to talk about the air quality monitoring that he does at the community level and how asthma surveillance at the state level is important to that work. We also have with us Sam Pickering, who is the Environmental and Public Health Policy Manager at Michigan Environmental Council. MEC is the host of this webinar, and we're very glad to have them host this informational session for you today so that we can talk about some actions that we can do at the state level. So next, I'm going to hand it off to Kezia, who again is from the American Lung Association. Kezia?
Thank you, Kendra. Hello, everyone. It is a pleasure to be on here today. I just wanted to introduce you all to the American Lung Association, our mission, which is to save lives by improving lung health and preventing lung disease. Every year, every spring, we release our State of the Air report, and this spring, our report was our 26th annual report, and it was first published in 2000. And it was the first of what we now call our signature reports. So we have other reports, state of tobacco control, state of lung cancer. And so far, our reports' longevity, reliability, and credibility, it's made it nationally recognized and respected as a resource, quoted among multiple sources in the media every single day of the year. I'm excited to introduce this report to you all and to let you all know what it's about. So why state of the air? Next slide, please. So, State of the Air report, it focuses the public's attention on the ozone and particle pollution, two of the most widespread and dangerous air pollutants that are regulated by the Clean Air Act and affects our lung health day in and day out. It puts the air pollution in everyday language. It gives the public information about their localities, what is happening in terms of their air quality. As I mentioned earlier, it focuses on particle and ozone pollution, and it gives grades to 885 counties with monitors. So out of 3,221 counties, it gives a broad range of grades to a lot of counties in the United States. And it ranks 25 metro areas with worst pollution um, um, and cleanest as well for three pollutants. Next slide, please. So what is ozone pollution? So this is separate. Whenever I give these webinars, I let everyone know that ozone pollution is different from the ozone layer. It's also sometimes called ground level ozone, or otherwise known as smog, to distinguish it, as I mentioned, from the high level stratospheric ozone layer that protects people from damaging ultraviolet rays from the sun. So the ozone pollution forms when a combination of pollutants, usually nitrogen oxides and volatile organic compounds, cook together in sunlight or under heat through a series of chemical reaction, and it creates this ozone pollution. And ozone gas it's a harmful lung irritant. When it's inhaled into our lungs, it reacts with the delicate linings of our airways, causing inflammation and other damage that can impact multiple body systems, and it can act like a sunburn to the lungs. So it's really important for us to know about it and its effect on our lung health. Next slide, please. So, what is particle pollution? Particle pollution is one other. So, in addition to us looking at ozone pollution, another pollutant we looked at in the report is particle pollution. It's also known as particulate matter or soot. This is a deadly and common air pollutant. So, particle pollution, it refers to a mixture of tiny bits of solids and liquids in the air, and it comes from many sources, including factories, power plants, and diesel and gasoline powered vehicles and equipment. Other sources of particle pollution includes wildfires. We're going to learn more about its effect, burning wood in wood stoves or other residential fireplaces, and burning biomass for electricity. Particles can be so small that it can enter into our bloodstream when after we breathe them in. Next slide, please. So air pollution, state of the air, the our report aligns with our strategic imperatives to champion clean air for all and improve quality of life for people living with lung disease and defeat lung cancer. So ozone and particle pollution causes harm to children and adults at every stage of life and across multiple systems of the body, not just respiratory. Air pollution also shortens lives, and even at relatively low levels. Populations that are particularly vulnerable to health harm from pollution exposure include children, older adults, people living with chronic conditions, including lung disease, individuals who are pregnant, people of color, people with low income, and people who work or exercise outdoors. Basically, someone in everyone's family is affected day in and day out by air pollution. Next slide, please. So our 2025 key findings are as follows. If we can go to the next slide, please. So our key finding this year is that more than 156 million people, which is nearly half of the US population, are living in places that are getting failing grades for unhealthy levels of ozone and particle pollution. This is nearly 25 million more people breathing unhealthy air compared to last year's report, and more than in any other state of the air report in the last 10 years. So as well, we found that 42.5 million people live in counties with the worst air, getting failing grades for three measures. These counties are spread across 9 states, six of which are east of the Mississippi River, a big change from recent years when they were more concentrated in the West. So deadly particle pollution continued to get worse, and ozone pollution impacted more people across the country. The burden of living with unhealthy air is not equally shared, we found. Research has shown that time after time that communities of color are disproportionately exposed to unhealthy air and are also more likely to be living with one or more chronic conditions that make them more vulnerable to air pollution, including asthma, diabetes, and heart disease. Next slide, please. This year, more people in more parts of the country are seeing their health put at risk from unhealthy air pollution, and fewer people in fewer places are living with the cleanest air. After years of reporting that the worst of the nation's air quality problems are largely concentrated in the western states, State of the Year 2025 finds that the geographic distribution of air pollution is shifting back towards the east. The year 2023, which is included in this year's report for the first time, brought somewhat improved condition to the West Coast, but also a deadly heat wave in Texas and an unprecedented blanket of smoke from the wildfires in Canada that drove the levels of ozone and particle pollution in dozens of central and eastern states higher than they have been in many years. Next slide, please. So deadly particle pollution continues to worsen, impacting communities in many parts of the country. This year, more than 77 million people in counties that got an F grade for short-term spikes in particle pollution. This is 12 million more than last year's State of the Air report, and more than a double of the historic low of 35 million in 2018. Wildfires in the US are not only increasing in the number of days and places with unhealthy spikes of particle pollution, but also the severity in of the pollution are increasing as well. Next slide, please. So this year, the nation experienced the highest in this year's report, we found that the nation experienced the highest number of red and purple days on the air quality index for daily particle pollution ever in the 26-year history of the report. There were over 1,200 red unhealthy days and 231 purple very unhealthy days, as you can see in the graph. And a glimmer of better news, there are only 27 hazardous maroon days this year, and it's not shown on our graph. That is fewer than the last couple of years, but still a sharp change from numbers in single digits of maroon dates reported from 2004 to 2019. Next slide, please. So to give us an idea of states with the highest level of particulate matter or particle pollution within the 2.5 interval, we see California, Bakersfield to Delano, Fairbanks, Arkansas, Oregon tied with Visalia, California, Fresno and Madera, and Hanford area metropolitan areas in California were also affected. Reno to Carson City, Nevada, that area was also affected. Los Angeles to Long Beach, California area, the Yakima, Washington State area, the Seattle to Tacoma area, as well as the Sacramento to Roseville, California area as well. So in the report, we rank the 25 worst metro areas for each pollutant. But since I only have room for 10, we put the 10 worst on the slides. So that's what you're looking at. And in the later on in my presentation, I will show you how you can be able to access your metro area and see how it's directly affecting your metro area or your family, members of your family who live in other parts of the country. You can show them how to access that as well. As you can see, the 10 most polluted cities for daily particulate matter are all in the West, but All but one of these, Visalia improved compared to last year, though they still get seriously failing grades. When you look at the rest of the worst 25, you see some eastern cities back on the list this year, like Pittsburgh, Indianapolis, Detroit, Lancaster, and Pennsylvania. And I'm really going to focus on Detroit in the coming slides as well. Next slide, please. So, year-round particle pollution. After more than a decade of the Lung Association's advocacy, last year the EPA finally strengthened its standard for what is considered unhealthy for year-round exposure to particle pollution. That resulted in a big jump in the number of people and places with failing grades in the last year's report, and was a long overdue recognition for widespread chronic nature of this deadly form of air pollution. This year's report finds 85 million people living with unhealthy levels of year-round particle pollution, slightly fewer than last year, but still the second highest number in the history of the report. Given the influence of transported wildfire smoke from Canada on annual PM levels, the states that worsened the most were mainly from North Dakota, South, and East, as far as Maryland. Next slide, please. All right. So most polluted cities for year-round particle pollution. We see Bakersfield, Delano, California metro area, Visalia, California is in again, Fresno, Madera, Hanford metro area, Eugene, Springfield area in Oregon, Los Angeles to Long Beach area. And we find that Detroit, Warren, and Arbor area tied with San Jose, San Francisco, Oakland metro area in California. Houston to Pasadena area in Texas were affected as well. Cleveland to Akron to Canton area was affected as well. Fairbanks to College area in Arkansas was affected as well. So we see Detroit, Warren, and Arbor area of Michigan in here as number 6. So which is pretty bad for particulate matter pollution. And here the 10 worst again the 10 worst metro area for year-round particle pollution from the years 2021, 2022, and 2023 are shown in this list. Last year, they were all in the West, but this year you can see some of that geographic shift. In general, cities in the Western states improved, and those in the Central and Eastern states got worse. Fresno and Los Angeles posted their cleanest levels ever, though they're still among the worst 5. Cleveland, in contrast, had one of the most dramatic shift from 54th worst to the 9th worst this year. And the Detroit area tied, as I mentioned, with the San Francisco area, Oakland area for 6th in the nation for year-round particle pollution. Next slide, please. So more than 125 million people live with levels of ozone air pollution that put their health at risk, about 37% of the population, and an increase of nearly 25 million from last year. This is a distressing reversal of the progress we've been seeing in recent years. The places that received F grades for ozone were spread across 211 counties in 35 states. That is 93 more counties and 10 more states than were represented in the failing list for last year's report. The hardest hit region in the country was a swath of states extending north to south from the Midwest to the plains down to Texas. Transported wildfire smoke and extreme heat were the major contributing factors. Next slide, please. So the most polluted cities for ozone are listed above. Despite the widespread worsening of ozone levels across the country, the worst 10 list and the worst 25 list remains relatively unchanged from last year. Los Angeles retains its perennial position at the top of the most polluted for ozone list, as it has for all but one of the report's 26 years, with a weighted annual average of 154 days of healthy levels of ozone pollution. This is the city's third year of improvement in a row, but it is still more than 5 months a year of unhealthy ozone days. Fresno, California, though still on the worst five list of all three pollutants, is making some good progress, reporting steadily failing levels of ozone pollution for the last 5 years. Next slide, please. And let me grab a sip of water as well. So on the other side, we also evaluated the cleanest city. And many cities in the US enjoy air that is considered clean for one or more of the pollution measures we track in the state of the air. A full list is included in the report, and I'm going to link the report after I'm done with my presentation. And there are, of course, many other communities in which there are no monitors, some of which probably would make the list if data were available. But among those places, where we have data this year, only two cities, so Bangor, Maine, and San Juan, Puerto Rico, are on the cleanest list for all three pollutants, meaning they had zero high days in ozone and short-term particulate matter or particle pollution, and are on the best 25 cities list for year-round particulate matter. This is a change from recent years when there have been at least a handful of cities on the list. Another indicator of the deterioration of air quality nationwide that we're seeing in this year's State of the Air report. Next slide, please. So I'm going to dive into Michigan. This is why we're here today, to learn more about where Michigan stands. So from our State of the Air report, we found that ground level ozone pollution in Detroit, the number of unhealthy days per year was increased to 6.2 days from last year's 2024 report, 5.7 days for number of unhealthy days for ground level ozone. It received a grade of F, which is a continuous grade of F from 2024 report. And our national ranking worsened from 33rd worst in last year's report to 45th worst. And Grand Rapids received the 27th worst in ground level ozone pollution report in our report. For particle pollution, Detroit received an increase in the number of unhealthy air days per year. So it went from 4.8 days from last year's report to 8.5 days in this year's report. So it went the grade went from a F to a D, and our national ranking it went increased to 22nd worst from 35th worst. And most unfortunately, Wayne County was listed as one of the most polluted places to live, as one of the 25 worst cities to live for ozone and particle pollution. So the image to the right was taken in 2023 by local ABC7 WXYZ Detroit. And it shows you can see that smog from ozone pollution that we're talking about. And this is really toxic for us to breathe in. So Michigan is really in the middle of this. Next slide, please. So the factors that I've been talking about, that our ozone pollution is bad across the country. And I just dived into the fact that Michigan areas such as Detroit and Warren counties have really high levels of air pollution. But now I'm going to dive into the factors that have contributed to this from what we found from our report. So the 2023 Canadian wildfires is spread across states in the upper Midwest and Northeast. We saw these areas were highly influenced or impacted by wildfires. In addition to smoke blanketing those states, I don't know if you can recall during that time in 2023, you couldn't go out without smelling that wildfire smoke. It was everywhere. So In addition to the smoke blanketing those states with high levels of particle pollution, the upper Midwest experienced the highest regional scale surface ozone levels ever recorded so early in the season. So, burning of plants and other organic materials known as biomass in wildland fires, this also produces particulate matter along with hundreds of reactive gases, including nitrogen dioxide, volatile organic compounds, and carbon monoxide. All of these gases can play a role in ozone formation, especially in sunny and hot conditions. So, in summary, increased heat and prevalence of wildfires led to these air pollution increases. And it increases the presence of the nitrogen dioxide and these volatile organic compounds that when under high heat it gets burned together and it produces ozone pollution and also particle pollution from our wildfires from Canada in 2023. Next slide, please. So, who faces greater risks from air pollution in Michigan? We find that individuals that are pregnant face a greater risk. The inflammation and oxidative or stress resulting from exposure to air pollution and during pregnancy, it can increase the risk of hypertensive disorders, including preeclampsia, and lead to intrauterine inflammation and damage to the placenta that can disrupt growth and development of the fetus. The fetal health may also be impacted in a number of ways by environmental contaminants that have been shown to cross the placenta. Um, Over the years, we've also found that people of color, that the decision people of color are heavily impacted by air pollution, which is decision makers have found it easier to place sources of pollution, such as power plants, industrial facilities, landfills, and highways, in economically disadvantaged communities of color than in more affluent, predominantly white neighborhoods. This has resulted in a more disproportionate exposure to air pollution, and has contributed to high rates of emergency department visits for asthma and other diseases. Um, we found that Black people are 2 times more likely to live in neighborhoods with high rates than white people, and Hispanic individuals are 3 times than white people to live in these communities with high rates of exposure. Um, as well, people living with lung disease, exposure causes respiratory harm. It worsens asthma for kids. So this is why I listed children in there. So if a child already has asthma, it inflames their lungs and worsens asthma. It causes or it worsens individuals' COPD, causes inflammation, and it also causes the development of asthma in children, which is really notable for us to see. And to your right, I've included kind of our data on the total population in Michigan. Um, Children under 18, individuals who are affected by COPD, lung cancer, as well as other diseases that are influenced by inflammation of the lungs. Next slide, please. I'm gonna go teach you through how to navigate our state of the air report on our website, lung.org/SOTA. Most people will be looking at the information about where they live, and you can get there in a couple of ways. So just under the image on the home page, marked here in the red arrow, you can select your location either by zip code or state, and by clicking on the state, we will show you information for all the counties in the state that have monitors, and the zip code entries will take you right to the appropriate county where you live, whether or not the county has a monitor. Next slide, please. So if you scroll down on the State of the Air landing page, you find various report cards we provide. There are rankings of the cleanest and most polluted cities for each of the 3 pollution measures, plus links to state and county level report cards. Next slide, please. So I just grabbed from the report, I just grabbed a screenshot of Michigan. you can see the high ozone days and high particle pollution days from 2021 to 2023 in our report. You can take a look at this at your own leisure, but I just wanted to take a screenshot of this to let you see it as well. Next slide, please. So on the website as well, when you can choose your metro area. So when I put the Detroit, Warren, and Arbor area, you might wonder how this year's report compared to previous years. And the trend charts on both of the county and metro area pages, it gives you an idea of the air quality over time for the three pollution measures we report on. And here we see the annual particle pollution in the Detroit area. And it's color coded and it's very interactive. And it shows you what we call a city for the purposes of our report, metropolitan statistical areas that can cover large areas of many with many counties. The bright blue line on the trend chart, it shows the average annual concentration or design value for this pollutant for every 3-year period since our report began 26 years ago. And the dark blue line represents the current threshold for meeting standard. So we're still right above the threshold, so we're still not qualifying it within the threshold. As you can see, the level of annual particle pollution in Detroit is above the new standard of 4 micrograms per cubic meter. In most cases, you can see a downward trend over time, and this was thanks to the Clean Air Act, at least until the impact of the changing climate started to reverse that trend. Next slide, please. So there's so much other great information in the report, and I hope you can take the time to explore it. The key findings sections covers the highlights that we're sharing with you today, and the section of the health impact air pollution, it provides the evidence base for why we do what we do, and includes up-to-date research findings on the health effects of particle pollution and ozone, and an explanation of which groups are at increased risk and why. Um, Next slide, please. So we're going to go into data, grades, and rankings. Where we get this data. So we use the most recent air quality assured data that is available all across the nation for full years, the 2021, 2022, and 2023. For the 2025 report, which I just mentioned, the states, tribes, and local air pollution agency have been collecting that data, and then they submit it to the EPA for review and validation. Once the EPA says it's good to go, they post it online. Typically, it takes until the middle of the year following when the data were collected for all of it to get through the process. That's why we do not have any data from 2024 because it's not ready yet. So 2024's data will be reflected in next year's report. Then with our consultant, we download the EPA data. The consultant does the crunching and collate the EPA data. And on that basis, we assign grades to the various counties. And once we see how bad the air is in the counties with the data, we can assign ranks to counties and also metro areas, which we sometimes call cities for short. Yeah, so next slide, please. So once we get the data, we back to our sequence of steps. Well, once the data from the EPA is analyzed, we do calculations from which we share our from which we figure out our grades. Then each December we provide these draft grades to our staff, in turn for us to share with different states, tribal groups, and local air agencies for their review and one last double check. Some of you have been involved, some of the individuals on this panel today have been involved in doing that. And I would like to say on behalf of the American Lung Association, a big thank you for everyone who's on the ground, on the front line, getting this data available for us to collate and put into this report. Most of the time, things are in good shape, but we do find glitches along the way. and much better than in April when we release our report. So we really appreciate all the local organizations that really play that pivotal frontline role in getting that data for the EPA as well. Next slide, please. So, what do we grade? A little more detail about how we grade. We grade two pollutants, so ozone and particle pollution. We grade them in similar but in different ways. For ozone and short-term particle pollution, we look at the number of severity of days with unhealthy air and use that information to get A to F grades. For the year-round annual average, we measure or measure of particle pollution, we assign a fail or pass grade. So in the usual case, a county could have as many as 3 grades for their air. Next slide, please. So grades are based on the air quality index of the EPA, which is the EPA's yardstick for reporting air quality. So for the two categories we look at on a daily basis, that is ozone and short-term particle pollution, we base their grades on the daily measure of the air quality index for each. Simply, this scale translates how bad the air pollution level is into levels of concern, and we use that information to give more weight to days that have worse air pollution. For example, orange days, days which are unhealthy for sensitive groups get a weight of 1, all the way up to maroon days, which are hazardous days that are weighted as 2.5 times as bad. So the bottom line is that we take into account how bad the ozone and particle pollution levels are, not just how many days with unhealthy air they are. Next slide, please. So there's a more detailed explanation of the grading process in the methodology section of the report, which is found on the website. But this chart can give you a good idea for how to look at things. So over the 3-year period, 2021, 22, and 23, for each county, for the 2 daily measures we've counted up, how many days there have been unhealthy air levels of air pollution. Leaving aside the complications of weighing factors, this shows you about how many bad air days over those 3 associated with the grade. And as I can see that a few people have put their questions in the chart, we can address that at the end. Next slide, thank you. Year-round particle pollution is different, as I mentioned, but in this case, we use EPA's calculation for what each county's long-term average particle pollution is. The units here are micrograms per cubic meter, and the calculated result is called a design value. Then grades are either pass or fail. The thing to concentrate on here is simply how a county's average compares to the national air quality standard of 9. Counties with levels equal to 9 or less than 9, they get passing grades, and only levels greater than 9 get failing marks. Next slide, please. So there are detailed criteria governing where air pollution monitors should be set up. In short, monitors are placed where they're likely to measure the worst widely experienced air pollution for that county, as well as in other areas in a county, such as a downwind of major sources. And note that this image is from California. Next slide, please. So many US cities and counties do not have monitors, leaving residents with no official monitored information on the air quality. Simply no monitoring for a pollutant in a county means no data and means no grade for that pollutant. Again, the great majority of counties, though about 22% of the US population, they live in a county without any monitor for ozone or fine particle pollution. Again, EPA and air pollution control agencies decide who get the monitors and not the lung association, and we're simply reporting on the data as they are gathered. Next slide, please. So how we rank cities. So all of the preceding gives you the idea of how we come up with grades for counties, but counties often are also regarded as parts of metro areas. Within each metro area's boundaries usually made up of several counties, and we look for the West County weighted averages and long-term particulate matter level, and we use those to rank the metro areas across the country. The Federal Office of Management and Budget, again, not the Lung Association, they decide what counties are included in things called metropolitan statistical areas, or even lumps them together in some places to make combined statistical areas. So rather than use these jargony terms I've been using, the Lung Association uses the word cities or metro areas interchangeably with those. And beware that these defined cities include but are not equivalent to political city entries. Um, yeah. So, yeah, thank you so much for your attention.
Thank you so much, Kezia. We really appreciate you highlighting the State of the Air report and also how this impacts how recent Canadian wildfires and heat have impacted recent air quality in Michigan. Next, to provide the clinician perspective, the perspective of what happens when patients end up in the hospital, is Dr. Alex Rabin. Welcome, Dr. Rabin.
Thanks so much. You can hear me okay? Great. My name's Alex Rabin. I'm a pulmonary and critical care physician at the VA Ann Arbor and the University of Michigan. And I just want to mention I'll be speaking in my private capacity and not as an employee of the US government, which I am. Um, so to kind of build on what Kezia was talking about with highlights from the Clean Air report, I just want to mention kind of some background, which is that as a lung doctor, I take care of people with bad lungs, difficulty breathing, and air pollution really impacts them on a day-to-day level. And I know that sounds obvious, but our lungs are the internal organ that interface the most with our environment. And so it doesn't really take a lot of imagination to realize that when air quality is bad, whether it's from the daily combustion of fossil fuels from cars and trucks and power plants, or from extreme climate driven events, including the wildfires in 2023, but also this year. It's the patients who have lung problems who often suffer the worst impacts. And there's a ton of evidence out there that air pollution is deadly and pervasive. And some estimates from the WHO uh, put about nearly the entire world's population living in places where air quality standards, as we think they should be, are not met, and that results in millions of premature deaths globally every year, somewhere between 4 and 10 million, depending which estimate you use. But those numbers kind of often belie the or don't necessarily tell the story of what that actually means for the patients in our own community. And I work at the VA, so I take care of veterans largely, who are not inclined to read the news or follow the mainstream media. They often don't have a lot of choices for the care that they get, and and they really don't have a lot of ways to protect them to protect themselves. And many of them also have outdoor work that requires them to be outdoors, or have a pre-existing lung disease from their military service, or from living in polluted areas for long periods of time. And these folks, are more and more coming to us, coming to my clinic, complaining of difficulty breathing. And I'm obviously somebody who's been very concerned about the impact of air pollution on health. But many of my patients now come to me unprompted. I mean, this happens pretty much every, I would say now almost every Monday and Thursday, especially in the Sunday summer months when I see patients. Um, Patients now come to me telling me that the air quality is bad from the wildfire smoke, and they're staying inside. They're having a really hard time breathing. Some of these patients end up calling in for extra prescriptions of rescue medications or steroids. And a few of them have to come to the emergency room, and a few of those end up getting hospitalized, and some even end up in the ICU, where I'll also take care of patients. So this is really a problem that's affecting our patients here and now, and more. I mean, again, these are anecdotal reports, but the data supports the fact, as Casey outlined in the American Lung Association report, that we're losing ground, despite the fact that we've actually made a lot of progress over the last decades with improved regulations of power plants and cars and trucks. We're now really losing ground from climate-related threats, and that is driving increased heat, which increases ground level ozone production, as we talked about, but also these massive wildfires that are blowing over our communities now. Basically, seems like almost every summer, and so it's a real problem. So, what do we do about it? Well, the problem right now is that, we have limited resources in what we can offer our patients. At the VA, for example, a lot of veterans ask me about air purifiers, and it's not something that the VA covers. And so we need to come up with smart strategies to develop early warning systems for veterans, get them medication ahead of time when bad air quality is expected or heat waves are coming. And we need to target, air purification systems for those who are most vulnerable, those who are on oxygen, for example, home oxygen, or who are already struggling to breathe every day with pulmonary fibrosis or other conditions. And just as, this problem is getting worse, kind of the rug is getting pulled out from under us. The VA, as you all know, is under threat, including our research enterprise, but even worse, what's happening at the EPA. And we all know that, as you guys probably saw on Friday, the EPA announced that they're closing down their entire Department of Research and Development. So it's a very, very concerning time, especially at the federal level. And so, I'm here to say basically that as a clinician advocating for my patients, many of whom are military veterans, we really need the support of state and local government to step in, support the essential research that needs to happen to target interventions to save lives. The sooner we can support this work, the better we'll all be. So I'll leave it there, and happy to answer questions at the end. Thank you.
Thank you so much, Dr. Rabin. We really appreciate your perspective. And myself as a nurse, I can attest that, yes, we are seeing more and more admissions in the hospital with patients with chronic COPD, asthma, etc. So let's hand it off to Elizabeth Hauptman, who is also an air quality advocate and can speak to the perspective of a mom of a child with asthma and what these poor air quality days mean for her and her family. Elizabeth.
Hi, and thank you to Dr. Rabin and all the folks who work in those spaces, because I'm the mom who sees you in those spaces. I'm Elizabeth Hauptman, the Michigan field organizer with Moms Clean Air Force, which is a community of over 1.5 million moms, dads, and caregivers across the country fighting to protect our children's health from air pollution and climate change. We organize parents and grandparents and let them know that they also deserve healthy air quality and a safe place for their children to grow up in a stable climate. Here in Michigan, we have over 170,000 children who live with asthma. For those families, poor air quality isn't just an abstract number on a report, it's personal. And it's deeply personal to me. Like I mentioned, my son, Oscar, has lived with asthma since he was a baby. I'll never forget the first time watching him gasp for air on a high ozone action day. It was terrifying. You feel helpless as a parent, and it is just awful watching them just gasp for breath. And one afternoon, while playing outside on a day with bad air quality, he had a coughing fit that just would not stop. And we had to rush him to an emergency room. His little body was just working so hard just to get a single breath in. Another time, he rode a diesel-powered bus just once on a field trip to the Lansing Capitol and ended up having an asthma attack on the way there because of the diesel fumes. I had to meet the bus and pick him up myself. It broke my heart. Even a simple school event could, put his health at risk. Wildfire smoke has added another layer of fear. I wrote a letter to the editor at the Lansing State Journal and Detroit Free Press about how Michigan's air has been getting worse from wildfire smoke drifting in. This summer, the last days of school, I was constantly checking air quality alerts to see if it was safe for Oscar to go outside and play outdoors with his friends. It was exhausting and a heartbreaking burden, trying to balance letting him be a kid with protecting his lungs. No parent should have to live with that kind of stress. No child should have to struggle for their next breath because of pollution. The truth is, protections from the Environmental Protection Agency are critical for families like mine. The EPA has been the backbone for cleaning up the air and protecting our health. Thanks to the Clean Air Act, 6 common pollutants has dropped by nearly 80% since 1970. Sulfur dioxide alone 91%, and lead in the air pollution has dropped 86% since 2010. Those protections have saved countless lives and prevented hundreds and thousands of asthma attacks, heart attacks, hospitalizations, and even early deaths. The EPA has also helped with programs like the electric school bus program. The Clean School Bus program helps replace dirty school buses, the dirty diesel ones, with zero emission electric school models, protecting kids right where they live and learn. The largest investment in environmental justice ever. The EPA was giving communities the resources to address unfair pollution burdens, but those protections are under threat. Fossil fuel power plants are still responsible for almost a quarter of all U.S. climate pollution. They also pump out deadly pollution that makes asthma worse. Moms Clean Air Force is calling on the EPA to stand firm on strong carbon pollution limits from fossil fuel power plants. Our children's lungs and their future cannot afford any backsliding. At the same time, the EPA is proposing to roll back mercury and air toxic standards, which limit mercury and toxins from coal-fired plants here in Michigan and in other spaces, of course, across the country. Mercury is a dangerous neurotoxin that can permanently damage developing brains. There is also no safe level of mercury exposure for kids. We need to tell the EPA loud and clear, do not roll back these life-saving protections. The bottom line is stronger air protections mean healthier, happier kids, fewer missed school days, fewer missed work days, and for parents in strong communities over the U.S. Since 1970, our air pollution has dropped dramatically, even as the U.S. economy has tripled in size. Clean air is good for families, but it's also good for the economy. So this summer, please join Moms Clean Air Force as we stand up for our children's health and climate safety. Tell the EPA, hands off climate pollution limits for power plants, and protect mercury and air toxic standards. Our children are counting on us. No child, not Oscar or any child in Michigan, should have to fight for their next breath. Thank you.
Thanks so much, Elizabeth. Thank you for sharing with us what's happening at the EPA and what actions folks can take to try and stop these rollbacks. It's also important to note that we expect some further rollbacks on particle pollution, which Kezia talked about in her report, so something to watch for. Next, I wanted to have Darren Riley talk with us about what he is doing at the state level with community-based air monitoring, and also why it's important that he works with asthma surveillance data at the state to help inform his air quality monitoring, and why it's important to continue these programs. Darren, welcome. Thanks.
Yeah, no, thank you so much. And thank you all for all sharing some great information and insights. So yeah, Darren Riley, based here in Detroit. I'm the founder of JustAir. We definitely started here, right here in Michigan, but our whole focus is to really ensure we can create a future where everyone has access to clean air. I think all of us on this call can agree that it should be a fundamental right. Just like the food we eat, the water we drink, the air we breathe, these are things that are going into our bodies and keeping us on this earth. So super on the forefront of that. So quick background, it's about kind of what brought me even into this space, just give context is, certainly the asthma. I developed asthma. I'm not originally from Detroit, by the way. Originally from Houston, Texas, but moving here after it's just 7 years ago, when I moved here, I developed asthma living in Southwest Detroit, and that's what opened my eyes to some of these health impacts around the environment, and also most of all the social determinants of health and health disparities that I've seen from neighborhood to neighborhood. So um, all that to say is what inspired us to build JustAir, and JustAir is really a platform in a partner to communities and local governments to be able to measure air quality data at a neighborhood local level, right? And to give that into context of this conversation, I think the air reports we saw, get a lot of the data from the EPA, which is great standard of data, and we're trying to move towards a more localized data set where we can get closer to the experience that community members are feeling in their bodies, right? So I think the analogy I like to use, and I also confuse people a lot when I use analogies, so just bear with me. But the analogy I like to use is thinking about if you're in your home and your child is saying, "Hey, I feel warm," or "I feel like I have a fever," and then you go to the kitchen to check the thermostat, right? We have air quality infrastructure in the U.S. today, and it's a huge gap, I was pointed out, where we may have regional monitors that can capture these regional events like fires, July 4th, fireworks and things of that nature. But at the local level, we see great disparities in real time of what's happening underneath those regions and to a block by block level. So all that to say is that we're here in Michigan, one of our largest networks. I believe one of the largest county-owned networks in the U.S. Here in Wayne County, and great partners at the health department at the county of Wayne, where we deployed over 100 sensor models throughout the 43 communities, where residents have free access to those early warnings and real-time alerts, so they can know better and do better. And so as it relates to this work here in Michigan, we also have done work all across the U.S., and we've picked up a great deal of learnings from California, from Texas to the Northeast. We're working in North Carolina, et cetera. And a lot of the learnings we have found is what are people actually doing with this data, right? And so this is where it really comes to, Kendra, to your point of how the CDC data and asthma surveillance can really play a strong role for us, not only just there, but also for the future of this work. It's sort of like how my grandmother says, if you know better, you do better, right? And so for us, Just Air, having this asthma surveillance data allows us to be more curated on where we actually place our instruments to make sure we prioritize our assets and infrastructure to the communities that need it most. So we have more information to have more targeted solutions, which I'll get into. And then the other part of that is when we actually, after we do our deployment, we can really focus on those communities and focus on those leaders who are doing that work in those communities and arm them with this information so that they can have a better response and also further spread awareness within the community to make sure that people are articulating that and have that environmental literacy they need to protect themselves and their loved ones, right? And just to call out some success stories of using the CDC data and surveillance, we've seen from New Jersey have asthma in-home programs, which reduced the cost of children ER visits significantly, especially Medicaid, children on Medicaid, and I think about 50% reduction for the controlled population, saving about over $1,000 per child per year, which is a huge amount of savings. In Minnesota, use air quality data and a combination of the asthma data to look at putting green barriers around highways and residential to reduce exposure. Even if we have those regional events or we have some of those local events, how do we actually reduce and mitigate exposure to those limits? And also even to New York City, where they have anti-idling zones, especially around schools, and very strict policies to reduce asthma, absenteeism, which is one of the largest reasons why kids miss days at school, not only in New York City, but all throughout the U.S. For our young adults. So all that to say, kind of shared a lot of information there, but when we talk about this data and asthma surveillance and also air quality data as localized as we can get it, it's really a question on, how do we want to really show up for our future, for our children, for our youth? Do we want to actually address this problem head on, or do we actually just want to kind of kick the can and really avoid some of the situations as they are. So yeah, I think that kind of sums it up. How I gave some good information. We do have a really great program here in Wayne County, which I'll drop the link in, but we have folks who can actually sign up in Wayne County and receive connected inhalers to track their asthma journal as they go about their day. And it kind of automatically allows you to see your air quality data and also what times you use your emergency inhaler to actually have more information on where your triggers are coming from. So more on that, but all that, none of this is possible without the surveillance data that we need to create the future that we deserve. So thank you.
Thank you, Darren. I appreciate you tying that all in, and that's a big reason of why we wanted to bring everyone here today. And I'm just going to segue into the fact that cuts to CDC funding are going to directly impact the Michigan Department of Health and Human Resources asthma surveillance program. And so that was why we wanted to educate folks about the air quality here in Michigan and share with you how important it is that we rely upon this data. For the last 20 years, our asthma prevention and control program has been 100% funded by the CDC. And we are at risk for all of that funding to go away. And so we're going to talk briefly about some actions that we can do to help protect this surveillance. Our Michigan Department of Health and Human Services partners that do asthma surveillance provide a ton of education to not only asthma providers and clinicians, but also to the community. They distribute a statewide, regional, and local asthma surveillance data, which would go away. They also update public websites that include vital information about asthma and surveillance data that also would go away. And they would no longer be sending out asthma news to over 8,600 people across the state. It's our current source of asthma resources, learning opportunities, and research. And they would no longer be able to develop national asthma guideline-based resources. So it's super important that we try to look for solutions. We have a couple action items. I just want to segue next to advocacy that the American Lung Association is calling for, and then we'll talk to the Michigan Environmental Council's Sam Pickering on some other actions that we can do. So Kezia, can you talk about the current actions that are available through the American Lung Association that we and folks on this call can participate in to help draw attention to the cuts at the CDC that are going to directly impact Michiganders?
Definitely. As Dr. Rabin mentioned, the EPA staff plays a really vital role in collecting this data for our report. They're at risk as that office was announced to be closed. The administration is also expected to cut at least 65% of the agency's budget. And a widespread of layoffs as well will affect them. As well as we have a petition that individuals can fill out, lung.org/SOTA. The Lung Association calls on everyone to support and defend the mission of the Environmental Protection Agency to protect human health and the environment. It's the EPA's job to do all of these things, and write and enforce rules to make sure the air pollution gets cleaned and we have levels that are safer for people to breathe and based on science and law. So it's their job to make sure that air pollution gets monitored. And if they're no longer able to do so, that will affect our lung health. So if you can all sign that petition for us as well. And on the state level as well, states can advance clean vehicle policies, and individuals can also keep themselves and their friends and family safe by checking daily air pollution forecasts at airnow.gov, preparing for wildfires and floods, such as by going to lung.org/disaster. And on the individual scale, we can also reduce our emissions from our vehicles, our home energy use, and as well, you can also use the power of your personal voice. You can share a report, share the action alert with people, which is pointed on here as well, and include our advocacy acts as well. And feel free to use our state of report in op-eds, LTEs, social media posts, and let's just talk about this and ignite attention to this. Thank you all.
Thank you so much. I appreciate that summary of actions we can all take. It's a good reminder. Sam, can I hand it over to you and we can talk a bit about what we could potentially do for legislators at the state level?
Sure. So thanks, Kendra. I'm Samantha Pickering. I am the Public and Environmental Health Policy Manager at Michigan Environmental Council. And we're an organization, a nonprofit organization based in Lansing, where we champion lasting protections for Michigan's air, water, and all the places we love here. So we basically work with policymakers and a wide variety of partners and stakeholders across the state to help develop preventative and protective policies that help improve public health outcomes. And one of the issues that we work on is air quality at the state level. And we've, realized today through this webinar and just our lived experiences in the last few years that this is a really pressing public health issue across the state. Like we're seeing high rates of asthma, and which is worse for those that are more vulnerable, and many of them are already overburdened by pollution and other environmental health disparities. So Michigan State Asthma Program has been critical in providing prevention and coordination services, as well as ensuring families have the tools that they need to manage the chronic disease. However, as we've mentioned, these programs are currently under threat from the federal level because since 2000, MDHHS's, so Michigan Department of Health and Human Services, their Michigan Asthma Prevention and Control Program has been 100% funded by CDC grants. So if the CDC's National Asthma Control Program is cut, that means the entirety of the state's program is cut. And that means programs in Michigan like MATCH, which is the Managing Asthma Through Case Management in Homes, that provides in-home case management for children and adults, and it's offered by several health systems and nonprofit organizations across the state, as well as the Little Lungs Asthma Training Program, which offers various trainings for both licensed and license exempt providers that includes information on what happens in the lungs when asthma starts, what to do during an asthma emergency, and how to properly use asthma medications would cease in Michigan. So we do need to explore ways to identify funding appropriations for the state's asthma program, because while the national program was cut and the threat of Michigan losing its program was live in action, now the federal folks have been slowly returning to work. So it was cut, then uncut, because obviously we've all been seeing a lot of crazy uncertain stuff going on with a lot of our programs that we rely on. So with that being said, that doesn't necessarily mean we're in the clear, and we need to continue to work at the state level to identify some resources, financial resources to allocate towards maybe not only this program, but maybe there's several other programs that would be a threat too. So, we need to make sure we have the funding to ensure Michigan families have the programs that they need to live with these chronic diseases. But additionally, we need to look at air quality at its source. So we've discussed all these different sources and point sources and non-point sources of air pollution. And then things become cumulative when we have wildfire smoke events, or we have our extreme heat days, or perhaps you lack access to healthcare. These impacts pile up and worsen population health. So right now, we were lucky to be able to reintroduce the cumulative impacts bill, which is currently Senate Bill 479. House Bill number will be coming. And bills like that provide us with tools to better protect overburdened communities by considering the full scope of environmental stressors and social stressors in permitting decisions for air quality and facilities that will emit pollutants, because there's like thresholds where they're allowed to emit a certain amount, but we're requesting that they take so many more things into consideration when they create permits for folks. So overall, this, like many other environmental issues, it's not a this or, it's more of a this and. So we need these pieces to work together and help protect all of our friends here and family here in Michigan and make sure we have equitable health protections. So we can just continue to have this conversation. So for legislators, having that conversation with your colleagues and in or across the aisle, like making sure we know that things like this are at threat and we need to be doing what we can to make sure we're protecting all of our families here in Michigan. So we should work to ultimately keep our asthma prevention infrastructure strong and look at protective policies that help reduce harm at the community level. And just sharing the word, sharing is caring, make sure everybody knows that these things are going on. And, I'm speaking for myself, but I'm sure all the other panelists would be happy to serve as any type of resource for you for information in the future to help support anything you might be able to take on to help with all of this as well. So thank you.
Thank you so much, Sam. That really pulls it all together and talks about what we can do at the state level, despite what's happening at the federal level. There's a great question actually in the chat, and I think this is going to be, we're going to spend the next few minutes just answering some questions. But I think this probably will apply to you, Darren. The question is, since reference monitors are sparse, and given that JustAir runs low-cost sensor networks, can you share what kinds of actionable findings or interventions have come out of those data? Have there been concrete changes in clinical advice, community alerts, or local policy that were driven by those sensor measurements? Thank you.
Yeah, no, yeah, it's a two-part question. The first part, absolutely. I think it's just like the evolution of technology and everywhere. From, we have a whole computer in our hands right here. As sensor technology, and I've just been in the industry for just almost 5 years now, has gotten better and better and better to get more and more accurate and more confident in information from sensor monitors, and you have the reference monitors. Both methods have, their own flaws. Obviously, the federal method for the reference monitors that we have sparse are very intensive and costly. And so having this low cost sensor gives us especially a dense network like we have here in Wayne County, and we operate a few others throughout the country, kind of gives us a better take on what people are really experiencing. So I think that's the future of this work. In terms of what findings and what this data can be used for, I think a prime example is to add color to what was said before. From the state of the air map, the more we can compare data sources, so we have, Ann Arbor, Wayne, I forget the other community, we're kind of grouped into a region. Um, we are assembled as a F, but even within Wayne County itself, we have some communities that may actually be a higher up ranking, like, C or so, and in some communities that are really on the F range. So the more we can compare relative with this data set, and we've already seen it in some of our reporting, the better we can be more concrete on what's going on there. What is the difference between this community within this county and this community over here, where we can really tie those things together. And the last one around alerts and proactive measures and policy. Now that climate change climate change has been, happening, hope we all can agree. But when we have those fires and we have those regional events, there are communities that are getting hit harder than others, right? So we see it in our data. We have, everyone's seeing the smoke, but the smoke is a lot denser because of all the other stressors that are happening within a community or a zip code or a census tract that is not happening on the other side of the track. So all that to say is that policies such as cumulative impact and all these burdens taken into consideration, the climate change is more near and dear, more important than ever. So this data can help inform that and reinforce that. So happy to give other examples, but I'll take my time from that. Yeah.
Okay.
Hope that helps.
No, that's super helpful. Thanks for answering that. Any other questions from the audience? We're right at time. And it looks like some folks have been, I know Kathleen Sloniger from AFA has put some resources into the chat for folks. And as Sam mentioned earlier, many of us are available to you. Please reach out to us. We'll share our contact information with the recording of the webinar and with our slides. And any other additional questions that come in, we can answer. Let me just see if we have any questions. One more question here. For folks that need to leave, I understand, but if you want to hang and listen to questions, we can certainly do that. And any panelists that need to leave early, please feel free to sign out. But I'm going to read this last question here. Samantha, thanks for looking at permitting and proposed legislation that looks at overall burden of pollution and the full scope of industry, like how much road traffic does the project generate? Example, an asphalt factory was proposed near Flint, right next to where a major freeway was being built. The factory would mean ongoing pollution for decades and transport of this material and road traffic from this factory to many other sites ongoing. I think that's more of a statement, but Sam, if you want to respond how that applies to our cumulative impacts.
Yeah, I mean, that says exactly what cumulative impacts are. I think that's a prime example of things that we're trying to have less of. So rather than being able to permit in a community that's already extremely overburdened by so many different stressors, they would have to essentially look to other locations for potential permitting options. It's a great bill. It's robust, it's comprehensive, it's very protective in nature. However, I will just note that these things take a lot of time, and given our current makeup at the state legislature with a Republican-led House and Democratic-led Senate, it's been very challenging. However, we're still working towards messaging and increasing awareness on the issue. We'll be having a press conference for this bill next week, so we can also share information for that if you're interested in tuning in. I think some folks will be live streaming it. And it's just something to, keep an eye on with us. And you can always reach out to your legislators too. They work for you. We can provide links in the follow-up email. So if you don't know who your state representative or senator is, you can identify that through plugging your address into the website, and it'll pull up all of their contact information. So you're always welcome to give them a call, bug their offices, and let them know how important this is to you and how concerned you are about it.
Excellent. Thank you, Sam. Just a final wrap up that we do have some action items for you to take. And so please go ahead and visit the petition that was at the State of the Air report for American Lung Association, and also the petitions that Moms Clean Air Force is sharing about actions that we can take at the EPA. It's important to speak up for these air quality protections and to ensure that we continue to advocate for the air quality in Michigan. Okay. Thank you so much for joining us today, and thank you for our panelists for their expertise and time. Have a nice day.
Thank you.